There is growing evidence autism is linked to air pollution.
A researcher at UWM published a study on that topic, and she found that pregnant women could be more susceptible to air pollution.
And joining us now, lead researcher Amy Kalkbrenner. Thanks for coming in. So why study this in regards to links to autism? Is it because it hadn't been done before, really?
That's an excellent question, and I should say that overall I'm really motivated to try to study things that we can do something about, you know, to make us all healthier. And when it comes to environmental chemicals or something like air pollution, it may be challenging, but we can do something about this. We can, you know, reduce the emissions from cars and trucks. We can increase public transportation and the walkability and the bikeability of our cities. So what I do is I focus on the most vulnerable of us, which includes the time before birth. This is a time when we're forming our bodies and our brains that stay with us lifelong. And when something goes wrong, it can lead to a developmental disability like autism, which impacts so many of us, directly or indirectly. And the thought that at a societal level we can reduce the burden of something like this offers tremendous opportunity.
So you focused on like traffic-related air pollution and its effect on pregnant women.
Correct.
Tell us about your findings then.
Absolutely. Thanks. So, in a nutshell, we found that exposure to air pollution particles during pregnancy, especially late pregnancy, was associated with increased autism. And you had asked whether this was a new finding. Aspects of it are new, but this is actually similar to studies that were done before. The evidence is growing that something might be going on with air pollution and autism.
What about chemicals that you use in your home? That would obviously be included in all of this.
Absolutely. So one thing that we know is that the number of chemicals that we're exposed to, the man-made chemicals that are simply all around us in the air, in our homes, in our workplaces, is over 80,000. Only a very small fraction of those has been studied with regard to human brain development. So there's tremendous opportunity here of undiscovered potential of ways that we can really enhance our health and well-being.
So what can people do to try and make sure that they're not afflicted or their children are not afflicted by this?
That's such a good question. And it really brings us back to sort of a classic public health approach. So, you know, we've had such gains over many decades in public health that it tends to be invisible. And then we have a tragedy like the spread of Ebola, which brings it to our attention. Obviously, something like air pollution exposures and autism it's more silent problem than Ebola, but also deserves our attention. And what we can do is increase awareness and move toward a precautionary approach of wanting to find out about these things and prevent them before the next public health tragedy.
Yeah, a lot of people talking about what causes autism and looking for some way to help. All right, thank you, Amy, so much.
Thank you for coming in.
Very
Amy Kalkbrenner, a
Thank you.
researcher and assistant professor at UWM.